No, I'm good. There's lots of technology in this room that we're relying on. So thank you everyone for coming tonight, and thank you for our clinicians for being here tonight. We have some people online across the province. We offered this session, of course, because there were people outside of our physical area that we wanted to reach. So I'm just going to do a tech check, and I'm not sure if we're good. They can hear us? Good. And for those here with me, this is new for us too, technology-wise, so just so you know, if you look on the screen, you can see what they're seeing. So when you're speaking, you will know exactly what they can hear and see. So thank you, everyone. My name is Colette Smith. I am Vice President of Clinical Services with Eastern Health, and I'm very pleased to be here with you tonight for all the wrong reasons. We have had a community event here which has affected a lot of families and a lot of people across our province, and we at Eastern Health are here to support you, and we want to reach out to you tonight. Why we're doing this session tonight is totally focused on the health of anyone who was affected by the event at the stadium that exposed any of our loved ones, you or your family members, to the carbon monoxide event. So the focus tonight again is to answer and give you information about your health needs. That's what we're here for as Eastern Health, and that's what we wanted to do. Why we're doing this session tonight is we felt that it was important to share information as we saw people very anxious, very unsure, coming to us for help, being treated with the most excellent team that we have, and we're very confident in that. But of course, it's a very, very scary and very anxiety-producing event, and lots of questions, lots of questions. I'm a mom, and I would have that. I'm a person, and I would have that. And we thought it would be a thing that we should do is to get you together if you had any questions and to present the information to you. What this is not is we purposely did not ask the media here because we thought the intent tonight is to help anyone who was affected by this event. So I'm saying that there's no media here, so I'm not sure if there is any media here, but we do have opportunity before and after to speak to media. Not sure online. So you can feel free to share any questions and concerns with us. What we thought would be helpful if we opened it up and gave a little information session on carbon monoxide, what that means from the clinical experts. We have with us tonight a lot of our clinical team here has taken their evening to help and hopefully support you and answer any questions we have. So I'd like to introduce the people who are here tonight. We have Dr. Ken Leday, to my immediate left, who is the medical director of the hyperbaric program. He's an anesthesiologist with us and also an associate professor of MUN. And I have to thank personally, before we move on, Dr. Leday. He's been with us every step of this one. He is our guru of this and has been so helpful and has a team behind him. But he has been at you and our help every step of the way. We also have Dr. Gina Bugden, who's our clinical chief of the emergency program with Eastern Health. So she has been, again, very close, and there's been a lot of emergency room presentations that she has helped guide and is here to answer any questions on that. We also have Elizabeth Kennedy, who's our regional director of the Mental Health and Addiction Services. We've had a lot of people who've come back to us with concerns about even the stress, anxiety that this may present to us. So we know we have support to offer you if any of you need that program. In the audience, though, also, in case there are any questions at all, we have Dr. Shaw, who's one of the Janeway emergency room physicians in the pediatric specialty. We have Jacinta Penny, who's our regional director of pastoral care and ethics, so in case there's some support people need. And we also have Barry Hewitt, who is with our mental health and addictions program. He is the provincial mental health systems navigator. So we thought we'd bring this team together tonight in case there were needs that we have not met, in case there were questions that needed to be asked, but most importantly, to provide you with information. And I'm going to pass it now to Dr. Leday first, who is going to just share some general knowledge of what CO exposure is, what it means, and provide you with any information. Before we start, I should say, so everyone knows, this is being live streamed. This is being recorded. So what we wanted to share with you was, if anyone couldn't make it here tonight, we will be putting only our faces up, this information, so that any one of your friends, your neighbors, anyone who wanted to hear this could go in and see it. We will stop when there's questions, so I'm going to ask when there's questions, they will come up after, because we don't want to air any of your questions live, but we want the information to be shared. And also for those online, at any point if there's an issue, just you can email, where's Stephen, they can raise their hand and let us know if you can't hear us. We'll know when we lose you visually, but if there's anything there at all, just let us know. So that's the format for the evening. And again, as our community, we're so glad here to be together to help everyone through this circumstance. So I'm going to ask Dr. Leday to come up to the mic. You need to be at the mic so they can hear, so he's going to come up and give us some information.
Okay, thanks and good evening, everyone. Can everyone hear me okay? First of all, I really want to express my appreciation to Eastern Health for organizing this event, and I brought the idea to them. I think it was a new idea, and I got to give a lot of credit for doing this, because we were hearing concerns amongst the parents. Also, I want to recognize and thank very much Dr. Bugden and all of her colleagues in the emergency department, who I think faced a really stressful, difficult time, so many people arriving in such a short period of time, and I think I really want to praise, how things went. I feel I'm amongst new friends tonight, a bunch of familiar faces. Despite that, I did want to warn you all that at the end of this session there will be a multiple choice examination, and a pass mark will be 80%, just so you're aware. But seriously, I'm going to go through a number of things. It's hard to know what level of information to give. And so I've done my best. It's just a guess, knowing what the types of people we have, and the high level of education of people that we have participating. But if anything is too much or too confusing, just let me know, and I can explain it. Again, my goal is to just be able to provide some medical information and guidance. I'm not providing any other type of information here tonight. A lot of questions, we've heard. Maybe these are some of the questions on your minds. Maybe you've got different questions, I don't know. Like, what are the long-term effects? What should I look for? What are the risks of long-term effects? Can anything be done to prevent them? What if my son or myself are fatigued or having other symptoms, not able to play hockey as well as he used to? What's all that about? And what kind of follow-up, if any, is needed? I'm going to try to answer some of those questions and some others. Carbon monoxide, is well known. It's called the silent killer for a reason. There can be immediate effects and delayed onset effects. The immediate effects are neurologic and can be as bad as loss of consciousness, difficulty thinking, impaired memory, effects on the heart, causing poor cardiac function, even just like an angina attack, particularly in those with coronary disease. Muscles, kidneys can all be affected. The delayed onset effects are largely restricted to the nervous system and the heart. And of course, for any stressful event, there can be a psychological impact for everyone. And after such an event, it can be very difficult to distinguish between the psychological effects of something versus the toxic effects of the exposure. And I'm going to do my best to try and answer some of those. Everyone has survived and is the acute event. And I think the question in the minds of a lot of people are, what about the delayed neurologic consequences? The term usually used is delayed neurologic sequelae. That's what you find online and on the internet. The numbers of occurrences for that vary widely from 10%, 20%, 50%. But the thing is not as obvious, when you're looking at those kind of numbers, is that it hugely depends on the severity of the exposure and the severity of the initial symptoms. So I don't want anyone thinking it's 50%, oh my God, it's a toss of a coin whether my son or myself is going to be okay. That's not the case. The delayed effects are largely confined to the most seriously exposed. The onset time is up to 5 or 6 weeks afterwards, although most occur in the first month. And the most common types of things are impaired thinking, sort of attention and concentration issues, personality issues, like upset mood, depression, that type of thing, and extreme events, Parkinson's, tremor type stuff. And the delayed consequences can be permanent. That's in the most severe case. And we're looking mostly at people who've been in a coma, perhaps have been on a ventilator in an intensive care unit for many of those people. But in the large majority of people, the delayed effects are firstly more minor, and there's a tendency to for those effects to lead to full recovery. There was nobody in this particular event that lost consciousness, and therefore I think we need to be reassured that the risk of significant delayed effects is quite small, and I'm going to show you some data about that I hope will be reassuring. Carbon monoxide is a gas. It binds onto the same part of the hemoglobin molecule that transports oxygen around the body, but it binds much more tightly than does the oxygen molecule, so it displaces oxygen, reducing the ability to transport oxygen around the body. The half-life, if you're breathing air, is about 4 hours. By half-life, we mean that's the time that, just like sort of radioactive decay, the time it takes for the level to decrease by half. So if you went through one half-life or if you went through, say, 2 half-lives before the carboxyhemoglobin was measured, and you started at 5%, after, if it had been 4 hours earlier measured, it would have been measured at 10, and 4 hours earlier after that would have been 20, okay? So that's how that doubling effect works. Normally there's very little carboxyhemoglobin in the blood, but there is some from normal metabolism. If you breathe oxygen, the carbon monoxide is eliminated from your body much more quickly, and in a hyperbaric chamber, a lot faster, only 25 minutes. Young people tend to get rid of carbon monoxide faster out of their bodies. They have a higher ventilation rate compared to their body weight than adults. And it is also important to know that the percent of carboxyhemoglobin, and probably everyone in the room who was involved in this knows what their own personal level was, what that is of their family members, and all carrying that around on a card in their pockets. But the correlation with the severity of symptoms is actually rather poor for all kinds of reasons, because you don't know when exactly it was measured. You don't know what the duration of exposure. A whole bunch of factors make it quite difficult. Carbon monoxide can also bind onto other tissues, affect other tissues, not just the hemoglobin molecule that transports oxygen, because there's very similar molecules in the muscle, both your skeletal muscles and in your heart muscle. And we actually know remarkably little about carboxymyoglobin. There's very little published on it. As I searched to try and be able to provide more guidance, it turns out the large majority of the literature on the subject has to deal with meat, because I guess this is an issue in the farming sector, veterinary sector, and exposure of meat. If animals were exposed, what do you do with the meat? Anyway, that's where the literature is. On humans, there's almost nothing. We won't cut people up and package it and then test them for carboxymyoglobin. Also, it can affect the cytochromes. The cytochromes are some very specialized enzymes in your body. People with a biology background will know about it. They're contained in tiny particles called mitochondria inside your body, and those particles actually produce the vast majority of the energy that your body uses. So that's really the potential to impact on the power plant of your body. And then there can be these delayed effects, which may be due to this complex chain reaction called lipid peroxidation. That's a little bit more complicated. We don't need to get into the detailed biochemistry of that. The person who investigated all that got the Nobel Prize, and I probably won't. But what we do think is that there are reasons to believe that the myoglobin in muscle, and the kids involved in this are top-notch athletes. I mean, they are muscular guys. They have a lot of muscle, a little bit more than me. But we would think that muscle could act as a reservoir for the carbon monoxide, and it would come out much more slowly, and may account for some of the prolongation of some of the symptoms, and even a bump up in the carboxyhemoglobin that we saw afterwards. But you can search through the medical literature all you want. You're going to find next to nothing about it, except about packaging of meat and stuff. So. I looked up some recent medical literature. I'm not going to go through, this won't be part of the exam, by the way. But I did want to point out some key factors that I hope will be reassuring to everybody who was involved in this. But this is a paper published in 2016. And on this slide, the abbreviation DNS stands for delayed neurologic sequelae, and non-DNS stands for, obviously, didn't have it. And so this paper was looking at the factors associated with delayed neurologic sequelae, okay, or the consequences that can happen afterwards. So what we look at is under the column on the right, the ones I've highlighted are highly statistically significant, meaning that we have a good measure of confidence about the meaning of those results. If you look at that, with the delayed neurologic sequelae, the average Glasgow Coma Scale, I'm going to tell you about that in a moment, was a 7. The maximum Glasgow Coma Scale that you can get is 15, okay? No child or adult who presented from this event the other day had a Glasgow Coma Scale less than 15, less than the maximum. In other words, that would have been completely normal in everybody who presented. Doesn't mean they didn't have symptoms, but nobody who was exposed in this event had a Glasgow Coma Scale of less than 15. And we know it's clear from this study, and there's others, but I'm just trying to be not too long in this presentation, that the delayed sequelae occur almost entirely in people that have quite low Glasgow Coma Scales. And even in this study where the average was 12, none of our people hit a level of 12. The exposure time, on average, for the delayed sequelae was even longer than what we saw in the hockey rink. On average, more than twice as long as what we saw in the hockey rink, and shorter in the people who didn't have delayed sequelae. So those are pretty interesting numbers. You can see that there was not much difference in here between, and in fact, in the delayed sequelae, actually the carboxyhemoglobin levels were lower. We can't read anything into that because it's hard to interpret that data. They made a whole bunch of other measurements, and they weren't all that necessarily all that helpful. I'm going to just present a few more from this particular study. You can see these are patients who had delayed sequelae, and the carboxyhemoglobins are all over the place because of a whole bunch of technical reasons. We can also see that the CK levels, and probably a bunch of people in this room, I'll bet you, might even know their CK number, because the CKs were measured on everybody who got this exposure. We do that because that can be an indicator of muscle exposure.
So is that true? You know your CKs?
Nobody?
No?
Okay, we kept a secret, okay. However, unbeknownst to you, we measured that, and these are sizable.
We saw it, though.
This one is going to be on the exam, so just make sure. We saw minimal, if any, elevations in the CKs in the kids. And that's despite that they were getting knocked against the boards. We had some kids who had a concussion event in the prior week. We did not see significantly elevated CKs in the vast majority of people. And in the very limited times we saw it, it was absolutely minimal. So here, another suggestion that for delayed neurologic sequelae, it's generally associated with a higher CK. And I think that speaks to both the poor oxygen delivery to the muscles and this carboxymyoglobin effect accumulation over a period of prolonged exposure with relative oxygen starvation to that muscle. So we're feeling good about that. We're also seeing that this group had lowish Glasgow Coma Scales. They had the extended exposure times. So, also the period of time for the development of the delayed sequelae are also listed there. Vast majority within 31, 32 days. Is this too much, or okay?
Is everyone following? Because we know there's a lot of technical stuff here, but we're here to help you. So, good?
Everyone good? Okay. Just the Glasgow Coma Scale. It's a simple scale, looks at eye opening and a response to commands and what have you. Nobody in this group has significantly decreased or any decrease whatsoever in the Glasgow Coma Scale, or any significant change in their CK, or any very prolonged exposure. So I think that's all should be reassuring as to the very low risk of any delayed complications. Some people I know have been looking up some of these terms about what the exposure levels are all about. But there's various agencies that publish permissible exposure levels. The ACGIH and NIOSH, they're U.S. agencies, but they're very large organizations, and Canadian authorities and many others worldwide defer to those or perhaps modify them. But the ones we're most interested in is the STEL, the short-term exposure limit. That's generally measured over a 15-minute period, or the TWA. That means basically, the easy way to think about that, if you collected a sample of room air continuously into a big bag and then measured the average overall after an 8-hour period, that would give you a time-weighted average, okay? That's what that is. And so there's standards that are published for these things. We know the most about it because a lot of occupational health legislation governs the maximum exposure that's allowed for people working in different environments. And so we know, for example, that the TWA for carbon monoxide is 25 parts per million. I'll show you some information from British Columbia. It just was easiest for me to find, but most places in Canada adopt the same standards. 25 parts per million is the TWA. I think I'll go back to that. There's various charts that you can see about showing sort of types of symptoms to be expected with different levels of exposure. So the TWA for carbon monoxide is 25 parts per million. The STEL, the short-term exposure limit, is 100. Okay, just because you get exposed to 100 for a short time doesn't mean that that the next morning you're going to be brain dead. It doesn't work like that. Even occupational regulations say, okay, if you have that kind of exposure, you have to have a break before you can risk any further exposure. I'm going to talk about a few other studies. This one was very interesting because there is a very limited information about other mass exposures to carbon monoxide. So we tried to find out what they found. So this was a study of people in a public high school. So they had duration of exposure shorter than at the hockey rink, a maximum of 150 minutes, and they found that it took longer for them to feel back to normal if they didn't get oxygen. This study did not have any long-term follow-up. Here's another one. It's actually more directly relevant. 504 children exposed at a school. They were younger kids than in this event, 8.7 on average, and they had 88% of the children had symptoms. They found that the carboxyhemoglobin was eliminated faster as expected. Their exposure was over 4 hours, but they measured the carboxyhemoglobin more quickly than occurred in this event. Again, no long-term follow-up. There is no study that looks at the long-term follow-up of this type of mass event, but they did find that there was poor correlation with the carboxyhemoglobin level, and that symptoms occurred in these children at levels of carboxyhemoglobin that were normally not associated with any symptoms in adults. These are the kind of symptoms that they had, and if you look at this list in the red box, drowsiness, shortness of breath, headache, nausea, vomiting, abdominal pain, it looks like very similar to the types of symptoms that the children and adults had in this event. So I think we're on the right page. And so they were having levels of 6 and 7% and all these symptoms. The treatment of carbon monoxide and the outcomes. There is quite good evidence that for the most severe forms of carbon monoxide, that people who've got a lower Glasgow Coma Scale, they've had a loss of consciousness, that the outcome is better and there's fewer delayed neurologic sequelae with hyperbaric oxygen treatment. There's some quite extensive trials. Again, there's no single trial published in the medical literature that every physician happens to agree with. No matter how good it's done, you're always going to find a crowd of people who don't agree with a word of it. But nevertheless, this is the best available information that we have. If you have 30 doctors in a room, you're going to have 50 opinions, I guarantee you. And this did find that with 3 hyperbaric oxygen treatments, for those who were seriously poisoned, there was a better neurologic outcome if they had hyperbaric oxygen treatment. But again, the hyperbaric oxygen was reserved for those who had the more severe symptoms, like loss of consciousness, etc. These delayed sequelae have been recognized for a very long time, and the theory that they may be caused by this odd-named process called lipid peroxidation that I told you all about before, the Nobel Prize guy. Then for preventing problems in the future, there's really 2 main issues, I think, for this group to be concerned about. Preventing future hockey players, other tournaments, other kids in ice rinks. We don't want that to happen. And that means, making sure we have the necessary standards in place for those rinks. And second of all, ourselves and your own kids, trying to make sure they don't have a repeated exposure. And I think that's a reasonable goal to set. And I'll talk about that now in a moment. There is already some guidance from the government of Newfoundland and Labrador. You can find it online. There's the link. And
that's several years old.
Yeah. And those things say things like the arenas, should have some type of surveillance. But also the question arises, what can you personally do? It's there is a possibility of considering, a handheld detector, and maybe something that's the hockey associations might like to consider. I think it's worth a thought. They don't cost that much, $150. Compared to what it costs to put a kid through a hockey program now. It's I don't have any here how many thousands of dollars. I'm trying to play for soccer programs for my kids, and they're not even a fraction of the cost. But I don't want anyone to think that, if there's one more exposure, we don't even know how many times they might have been exposed in the past. We just don't know that. And I don't want anyone to think that, if it happens one more time, he's as good as dead. That's not the case. Okay, but, we would due diligence, there's a case to be made. Maybe just it's good to be aware of it and inform parents and hockey players and see what you can do yourselves to protect yourselves. So I have a little bit of, I'm going to wrap up now before we move on to the multiple choice exam. I have some basic advice. If this exposure had been a bit longer or a bit worse, it could have been much worse. I think we've seen that from some of the numbers, medical literature that I've presented with you. And so, good. It's you should feel good. I think that everybody should feel good that it wasn't, and not worry. But also be aware, that it could have been worse. The risk of delayed consequences or sequelae. I got a lot of trouble over that word sequelae. It's too difficult a word, but anyway. But that's what you're going to find online. So, but the risk in everyone involved in this incident is very, very low, and you should feel confident of that. And that assessment is based on assessment of the most up-to-date medical literature, the best available information. Repeated exposure is not helpful, okay? And so it's wise to be informed, wise to be aware that this can occur. It won't be overnight that there's a sudden conversion to electric Zambonis, but being aware it can happen overnight. Prolonged exposure is an important risk factor. If symptoms are developing during a hockey tournament, for example, hey, don't say it's okay. Start asking questions. And there is a move now. We used to have provincial-wide guidelines for how to manage patients when they present to the ER, because if you had 4 different ERs or 10 different ERs in the province, you'd have at least 40 different approaches to what to do. So I think we've been having discussions with emergency physicians, and we're going to try and have some standardized guidelines, which I think will be very helpful. And so I'm very encouraged by that. And lastly, I think there's very strong reasons for everybody here to be optimistic for a complete recovery without long-term harm. And to that, I couldn't cover everything, but if there's any questions or comments, more than happy to entertain them.
I think, yeah, maybe I'm just conscious of the recording and the privacy piece, so with questions, we're going to probably just, I'll moderate that a little bit. So, Dr. Ledet, thank you. That's wonderful information, and I see people in the room very, very interested in the information, and that's what we're trying to do tonight. I remind you also that we have some other expertise in the room, so there's no formal presentation from these folks. They are here to answer any questions that you may have from the emergency room perspective, and also the mental health perspective, and your community support that we're trying to offer as Eastern Health. Also, I was supposed to tell you in the beginning where the washrooms were, so if anyone needs to go, they're up there, and I apologize. So we're going to open it up for questions, and we're going to keep the questions general. What Dr. Ledet has offered is, because we're recording this and we want this to be available for everyone across the province, but Dr. Ledet and our team have offered to stay here. If there are any individual questions that you want answered, we will stay after the recording stops. So then we don't need to worry about the privacy issues or anything being aired that you or we cannot share. So we're opening up questions now from a general sense. And then also for those online, I know you can't ask individual questions if it's of a personal nature, but you've registered through that email address. If you have them, reach out to us and we will definitely get back to you. That's what we're here to do. So I'll open it up for general questions now, and if I need to stop you, it's not because we're not going to answer it, it's because we don't want it recorded we're all under the same, caution about that, but we will answer it offline. So I'll open it for questions, and I'll go to, in the back, sorry. Maybe, and I'm going to have to repeat the question, by the way, because you can't hear it online from here, so if you could speak and then I'll repeat it. That's a really great question for those, so I'll repeat the gist of it, and if I get it wrong, please tell me. And I'll hand it to Dr. Ledet to answer. So the question is, how do I tell the difference between drowsiness and my child fell asleep on the way home, given that Dr. Ledet has tagged loss of consciousness as some of the things to look for? So I think it's, that piece, I don't even know if he was asleep or if he had lost consciousness. Is that okay? Yep. All right, so I'm going to hand that to Dr. Ledet.
Yeah, what a great question. Falling asleep is not loss of consciousness in the same sense, in the Glasgow Coma Scale, if someone's arousable, say, hey, Johnny, whatever, come on, it's time to get out of the car, you've been sitting there for an hour, your McDonald's is getting cold, whatever. No. Drowsiness certainly can occur, but of course, kids that would be fatigued, they were working hard in a hockey game, and their ability to transfer oxygen around their body and to their muscles would be impeded even by quite low levels of carbon monoxide. But no, falling asleep in the car, that's not loss of consciousness. And if we'd scored them on a Glasgow Coma Scale, they would still score 15, guaranteed. Not even worried about that.
Dr. Bitnew, I definitely can't recapture. Say Zbitnew. I apologize. For those online, though, they haven't heard you. So I can't recapture that, but I think he was reassuring that there's a lot of different symptoms. He explained that if someone lost consciousness, you would actually drop, maybe even experience or probably experience incontinence of fecal matter, urinary matter. So being drowsy, if they were arousable and you got them into your home, that was a little bit different than what we're talking about when we say loss of consciousness. I don't think there was anyone here who didn't get, they may have been drowsy, but you didn't get them into the home. All right, so there was a couple of,
Just say
oh,
something
sorry,
quickly.
Gina?
Yeah, just to add to that, so I don't really need the mic because I'm super loud anyway. But drowsy.
Do for online,
I
so
know.
for once you need the
So
mic.
drowsy is one of those words in the medical field that means something very different to kind of like everyday language. So you're absolutely right. You say your kid is drowsy, they're sleepy, but you know, okay, here's your Tim Hortons, and they wake up. Drowsy for us more so is, come on, okay, can you hear me? Can you hear me? Like, you know, rub, pinch, and moaning. So it is really different, like Dr. Zabitnu and Dr. Leday said. So it's one of those words that means different things to different people, but two different circumstances completely.
Thank you, Dr. Bogdan. That's great. Did that help? I have another question there. Yep, sorry. So that's interesting because Dr. Leday and I and the team have talked about approaching you, and we've been very cautious that tonight was about you. But knowing there's not a lot of evidence or literature or knowing what to do, as we've just described, there's an opportunity here for all of us to maybe learn from what we've all been through as a community. So we're not going to ask you that tonight. What we're going to ask is maybe we can reach out to you and ask if you're interested in us to explore that, to help others who may have been through a similar incident so we can get more evidence on long-term impact. But tonight was about really answering your questions immediately. There definitely is an opportunity, and I think we as a community have actually an obligation probably to help people learn about this, but we'll find a way to get to you. So I think the Hockey Association, and if you're open to that, we will reach out. We haven't lost that because we all need to learn from each other on that. But yeah, we didn't bring that tonight because that wasn't our priority tonight. But we're very, very focused on it.
The last case of carbon monoxide poisoning at rinks.
No, I don't think so.
We want someone.
And I think in the world, the fact that when we went to look for what to share, there's really limited research and evidence on it. And we have a group now in our community, very close, right? We have a good opportunity. Dr. Leday brought it to us to his credit, and we told him, don't talk about that tonight because that may not be. We did. And, but we will, if you guys are open to that, we would love that. And Dr. Leday would love that. And I think it's a learning for all of us. Thank you for knowing that. And for those online, I forgot to repeat, I'm not a very good moderator. But the conversation in the audience, in case you didn't hear, hopefully you did hear, was, are we going to look at any research or learnings, or how do we share this so that other people know and we learn how to manage this event, this kind of event, because it happens. And there was someone else in the audience who had researched and found that there was another example of a similar incident throughout our country. And what we had said was we didn't think we would approach you tonight on that, but it certainly is an interest of ours. And I think all of us probably, as I'm hearing you talk, that we would learn through this and learn through the long-term impact and maybe even go further to see long-term effects and try to help anyone else. Dr. Leday, I shared, was very interested in that. So I don't know if you have a commentary about that, but I'm thankful for your comments. And he could probably lecture for 2 hours on this because he's very, very interested in this, which is great. So I think our question is, how do we reach you? How do we reach you in the right way in time to come to make sure that we don't drop the ball on that, that we can actually make that happen?
So a key issue in this regard is research ethics. Even having the the right to reach out and contact people to say, hey, can we follow you up? Can we access the medical records? And we need permission to do that. And I need permission even to ask you for permission. And so that's something, if you don't hear, that's not because we're not interested, but I need permission to ask permission. So providing us with emails and contact information to say that, yes, you're willing to be contacted, I think is an important step, because then once you've done it, you can reach out to the other people you know and they can do it, because I can't even, except for the individual care of an individual patient, I can't just go browsing through stuff, to see if I can find something. I have to have formal permission with an approved research protocol to do
So
that.
Dr. Leday, because you've advocated so hard, we're very well prepared, just in case this came up, just in case. We did have some sheets there, and our intent was, do you want follow-up from us? And the intent wasn't for the research piece, but it can be for that. But if you want follow-up from us in terms of advice, care, if you have any concerns, who do you go to, those type of things. If we have a sheet down here, if you want to sign it, that will also give us permission to reach out to you as families and people who've been through this to actually start some of that, what you're talking about. So at the front of the room, we'll also, again, everyone registered by email, which is why we did this. We can reach across to anyone online to send the same thing. And if you sign that tonight, that gives us permission to reach out to you, but it's only to reach out to you, and then you'd have to give, it's not an open, we will be in touch with what we're trying to do with that. And we were really hoping that we could probably share our learnings with this for other people, because this is not a unique event, or it can happen to anywhere. And fortunately, our community has been very fortunate, and we've had a great medical team and a great community that's responded well. And I think we're in good shape, but let's share what we've learned, because we have lots to share. Other questions? Yes. So I'm just going to repeat the question, and Dr. Leday and probably Gina might want to weigh on this, because the question was in terms of half-life. And we mentioned, Dr. Leday mentioned in his presentation that it could have been a lot worse. Again, I'm repeating this online, guys, so the room knows why, sorry. The half-life, if it was a longer exposure, it could have made it a lot worse. So what could have made it a lot worse? Is that clinically, or is that response time, overcrowding? So you guys might want to tag team on that.
Okay, I'll answer first, since I was already standing up, and then turn you over to Dr. Bogdan. When I mean that, when I say that, I mean, when we looked at the carboxyhemoglobin levels and the symptoms in all the adults and children, we made allowance in estimating what the maximum carboxyhemoglobin levels could have been. And so, we certainly are aware that the levels were higher at the time. And so when I'm saying that the risk of delayed sequelae is very low, I'm taking all of that into account. Okay, so let me set your mind at ease completely on that. I'm not I'm absolutely categorical about that issue. That I think we have a very good handle and grasp on what the level, the degree of severity of the exposure was. What I mean is, if there'd been, less ventilation, if the hockey tournament had gone into the night and everybody was still there, if all the kids were crowded around close to the Zamboni the whole time, I mean, there's a whole range of things that would affect it. But in assessing the severity, we've looked at the severity of the symptoms, because that's the most meaningful indicator. Also taking account their level of carboxyhemoglobin. But if for whatever reason the machine had spewed out more monoxide and the ventilation had been less, a bunch of other circumstances, it wouldn't need to be 3 and 4 times worse than it was. If it had been somewhat worse, we could have had some more seriously affected individuals, which we didn't. But being mindful, I think we got away with this time. We don't want it to be a worse next time, or to have any next time. But I'm very comfortable in saying that I think we have a very good handle on the severity of this exposure. and thank goodness it wasn't worse.
And I'll just comment quickly, and you talked about resources being overwhelmed. So we are prepared for these types, sorry, I think they can still hear me. We are prepared for these types of things. We have a whole department here at Eastern Health who plans disaster management. This is something that we do put a lot of time into and some practice sort of efforts. So whatever came that night, we would have handled. Lots of good coordination within the hospital, lots of staff stay behind, and it was a Friday evening, so a little bit different even than if it was, midday on a, any other day of the week per se, but everybody pulled together, and, if we had more people that night, and if circumstances had been different, we still would have rose above. Yep.
Yeah, I mean, just to add briefly to that, I want to add, when I got called in to give advice and stuff, I looked around and I thought, well, where's all the panic? Where's all the, it wasn't like that at all. It was, things worked like clockwork. It was remarkable how well the system coped with this event. It was remarkable, and full credit to all those people whose job it is to organize for these things, and to the emergency physicians who were calmly going about their business. I think I was more excited than they were, but anyway, it was impressive.
I will just add, we have our health and emergency management team here with us tonight. So you can imagine in healthcare, we have to be prepared for any unexpected event. And we have plans, practice, all and teams in place, and we are prepared, and will respond to any community emergency, as you've seen. I hope you've seen. Yes. That's a really good comment. So for those online, we're talking about advocacy and how do we prevent this from happening again as a community, and that the risks that we know are out there, and how do we make sure that everything is in place so that what we know as risk doesn't occur again. Did I reflect your comment? So I'm with you. We're all part of this city. We're all part of this province. We're here tonight as your healthcare team, so I don't know that we can comment other than say we all want to reduce any risk in our community. The response from the healthcare team is what you need from us, and we will be there for you anytime that happens. So I think the advocacy for safety in our community is a role for all of us as citizen members, but it's really something beyond what we're here for tonight, other than to say, when you need us, we're here, and if we can partner as part of the community, but it's something, I think, a bigger discussion beyond tonight, if that makes sense to you. I get it. It's one of your...
Eastern Health certainly can't lead the charge on the advocacy part of it, but we can certainly touch base with our government representatives and
We are here with you as members of your community, and we know the risks that are out there. So if there's information or partnership that we need, Eastern Health's mantra is healthy communities. So that's our goal. That's why we're here tonight, to help you. So yeah, absolutely.
Perhaps I can make one comment that shouldn't be, two comments that shouldn't be too controversial on that. First of all, probably people might have gathered that exposure to carbon monoxide is a long-term interest that I have, and I am available, as are my colleagues, Dr. Zbitnu, Dr. Redmond, and the other two hyperrec physicians, Dr. Crummy and Dr. Murphy. And you can certainly reach out to me for advice, okay? It's not really what this evening is for, but I'm more than happy to be able to give you some specific advice on that. That's one thing. And I gave a little bit of information already in the slides, a couple of practical ideas, so you can reach out to me. I won't be hesitant to help. And costs, well, I can tell you I've been way too busy to submit any bills to MCP so far for anything I did at that time. But perhaps, so it hasn't cost them anything for me so far, but maybe a few weeks down the road when I get around to doing it, it will.
We'll give them a pizza or something. I just want to reflect too. I know we've been really talking about the physical aspects of this and the advocacy and healthy and prevention, which is all great. I do see a lot of emotions in the room, and I can empathize only with you. We are going to have some people stay behind here tonight to talk with you. We do have our mental health care team here, and that doesn't mean anything more than if anyone needs support or a way to get some help with what this has caused, even if it's stress or coping, or how do I talk to my child now about this to relieve some of their anxiety. This is big. I'm sure your children have been, as I see you here as parents, they must be feeling something too. So if there are any questions, we welcome them here, but I do appreciate you may want to talk to our team, and we will stay behind. There's our mental health director here.
And Barry can correct me if I say anything wrong, but it's hard to recognize sometimes when you're going through the crisis of it that you need help, and some people are hesitant to ask for help. But if you feel anxiety, if you're feeling really you're not sure about anything said about stress, is it anxiety? There's a fantastic website that's out there called Bridge the Gap. It was an app, but it's actually now a website. And we do have some handouts there, not for Bridge the Gap specifically, but if you Google it, like we all do, and you go online, if you sign into it, there is just a multitude of services there and information for you, all free. There's links to other services. There's all kinds of questions there. There's a whole resource library there. There's just so much there. There's sections for children, there's sections for adult, and a whole bunch of different things. I'd highly recommend it for anybody to go on to it and look. Mm-hmm. And then there are services in our community. If you really feel you want to talk to somebody, there's a doorways, there's a walk-in, no appointments necessary. So there's all kinds of information out there. And if you're even thinking about it, it's really worthwhile to just go in and just have a look at it, and then just see what you need and for your children as well.
Thank you, Liz. Thank you. So the question for those online, is there any preventative care we should or could be doing now to lead into the future? So Dr. Ledet does have some thoughts on that, I think. We've talked about that as well.
Yeah, and so I looked at what the literature is out there, and it's very supportive that these things do settle down, and you should just return to normal activities as you can. If you have an ache and pain, just take whatever you would normally take. Just try to get back to normal, and especially for your kids. We don't want them worrying unduly. We want them to get back to being kids and the great hockey players that they are. I understand there was a championship victory, and despite this, so let's. We can't say it's because of this, but it's a sign. It's a sign of the. Well, you beat somebody else who was online, did you? Okay. It's a sign of the ongoing recovery that should help to provide confidence too. And congratulations to the champions.
That must be.
So just to add to that, like Dr. Ledet said, a lot of the symptoms at the time were, I'll use the word non-specific, meaning sometimes can be confused with cold and flu symptoms, nausea, vomiting. Bit difficult this time of year because this is the time of year when we tend to see a lot of viral sorts of things. But if you're concerned, then we're obviously open 365, 24 hours. So we're here, come on back and see us. At this point, unless there's a re-exposure, there's really no role for further investigations like EKGs, blood works, or even oxygen therapy, really. But we're always happy to see you in a session and see if there's anything else we can do for you. Thanks so much.
So comment on for those online is that I think very complimentary to our clinical teams who are well ready to serve anything you need and we need as a community. We're all part of the same community, and we are very proud of our team, so thank you. That is wonderful to hear again for those online, the very thoughtful comment from parents who here with us who saw the response from the teams, and we appreciate those comments because what we want you to know is we're prepared, we're here. You have a great healthcare system here. I know there are, at times, but when we pull together and as a community, there's nothing better than the teams we have here. And I would like to echo your comments because we are stepping back and trying to manage it from the management side, but to see the expertise, the clinicians, the dedicated people who are even here tonight with us to share with you any information, because we thought you might need some support like that, is absolutely tremendous. So I can't even I echo your comments. It's a tremendous thank you from us to the clinicians here within our province. So thank you.
I did want to make one quick further comment to that, because it wasn't only the clinical teams. The administration played a very important role in this. People may not realize, that they helped to coordinate all this. And the night of that event was the very first turn at being on call for the administration for Lynette. And
it was.
and
The director on call that night, it was her
very first time being on call for the administration.
Yeah.
And yet she wasn't panicked. She was there supporting and helping to liaise and coordinate, and that should be recognized. It's not all the clinical team. It does take a substantial administrative organizational effort too to make that possible, because the clinicians, it's like herding cats, but the organization, it makes a difference too.
Any other questions? Yes, thank you. So I'll hand it to Dr. Leday in a minute, but just to assure you that a response like this in an event like that takes a whole community effort. So beyond the healthcare information we're giving you tonight, we're also part of your city's response team, and our health and emergency management group are actually reviewing with the response through our partners on how we notify, and all those things happen. So we're getting better and better at that. But in terms of symptoms, okay, that's great.
Very quick comment. I think you guys did an amazing job of contacting each other. Without those contacts, we wouldn't even have known that there was an event. So I just think that I think you guys did an amazing job, and you nailed it. You picked up on all the symptoms. So that's one of my most the thing that impressed me the most about the whole thing.
You're so close to
I think we were lucky we had a few physicians on our team, as you can tell, but we don't always have that on every team, so,
But you knew something.
that helped, I think, right? Yeah.
So my job is a 24/7 Peds Emerge doc, and a lot of what we do is not resuscitation, but it's counseling, educating, reassuring parents. So what your gut feeling is, and if you thought it was different than what his usual behavior was, trust that gut. And you did that by calling your teammates' parents and finding out those symptoms. But Advil, Tylenol, the supportive care that we do recommend, if that's not helping, if that's not minimizing symptoms that are vague like this, then that's definitely symptoms that we would see and either treat or reassure based on what's happened.
That's very reassuring from a pediatric physician. As parents, trust your gut. You did. That's why, we got the response we did. Any other questions? So again, we're going to put this up online so that others in the community that weren't able to make it tonight or weren't able to log in across the province will have the same information. We are here for you. If you have any concerns, our emergency departments, as you know, are open 24/7. Sorry, one more hand. Of course it would be. Of course it would be.
So that summary of the question was about the hockey players and their parents who had a delayed presentation after being notified, or some of the guilt maybe that they were feeling. So I was actually the overnight doc at the Janeway when this event happened. So I was seeing kids up until about 4 a.m. and then all through the weekend as well. And what we do is take a good history and physical of pre and post event, and also reassure, because the kids who showed up later on had lower levels and their symptoms had minimized. So it was a lot of just reassuring and not putting, or I guess minimizing that guilty feeling, And if they were able to carry on with their daily activities with some mild symptoms, then we were advising just to treat supportively. And if those symptoms continued or worsened, to come back for reassessment. And that's the important piece, is that reassessment, or knowing that there was a place for them to get reassessed if there was still that worry.
And there is one more piece that's actually in the data that I presented, because in some of those mass exposures, there was a facility that did not administer oxygen to anyone, and but as I say, I was confident of the level of symptoms and the level of exposure that we knew where it was, and the only thing that came out of that study is because the symptoms weren't of the more serious nature, I don't think there's any concern that because they didn't have an hour or 2 hours of oxygen, that they're going to develop delayed neurologic sequelae. What came out of the papers that I've read is that it probably would have taken them longer to feel like they were back to normal. Okay, and that was a statistically significant result from one of those studies. But if they'd been worse, I think we can be pretty confident they would have come in. You know, so I think that those people who didn't, they should be reassured, and that all is well, and again, not to worry.
Yeah, so what we thought we'd do is we've been reaching through, now forgive me, my boys never played hockey, thank goodness. And I don't mean because of this, I mean because of the cost of equipment. They were volleyball. So I get that there's an association, right? Because if I wanted to reach anyone when my boys were playing volleyball, I'll go through the NLVA. So what we're going to do probably, we need to talk about this, is maybe reach through your hockey Newfoundland. Thank you. So we'll reach out. You guys can help us and talk through so people aren't surprised or know, they may know what's happening. We'd be happy to come talk with any meeting that you have. We're here for you. We're part of this. So maybe if you can, remember there's a sheet there to start this, and then maybe, I don't know, we haven't really thought through this, so we want to reach out in terms of the research. If you have a forum for us to come and say, here's what we're looking to do, we'd be happy to partner in that.
We're very good at spreading information.
I think you have a little bit of a reach across the province. Yep, that's right. You got some buddies across the province, right? So can we leave that with you, and when you want us to come, like, we'd be happy to come speak and get whoever we can across the province. We can't, as Dr. Leday said, because of the legislation, we can't reach out to those people. So you're probably our avenue, and it would be great partnership. So we can talk more about that, and we can probably reach out to some of the contacts that we have already. So what I want to say is thank you for coming out. We're going to try to do more of this with some public information. We really appreciate it. We're, as I said, we're all part of this community. We're all here as a community together. So please reach out. You have our information. You know how to get there. If anyone wants to stay behind, we're going to stay behind. And the best news is everyone's okay. And that's great. So thank you. Thank you.
I know it is late, but we do have these multiple choice questions.
Thank you to those online. Again, just send in anything that you have.